supply the body with oxygen and to remove carbon dioxide, ambient air circulates through the body, starting at the nose and ending in the alveoli. Let's take a closer look at how air moves through the respiratory system. Air first enters the respiratory system through the nostrils and reaches the nasal cavity. The hair lining the nasal cavity filters the air. The mucous membranes warm up and humidify the air. The air then enters the pharynx, where the respiratory and digestive systems intersect. Here, the uvula rises to prevent food from entering the nasal cavity and lowers to allow air to pass between the nasal cavity and the pharynx. The next structure is the larynx. It contains the epiglottis and the vocal cords. The epiglottis is a cartilage extension, acting like a little door to prevent food from passing into the trachea during swallowing. Two muscle fibers vibrate when air passes through. These are the vocal cords. They produce low-pitched or high-pitched sounds, depending on how open they are. After passing through the larynx, the air enters the trachea, a tube with a cartilage rings connecting the larynx to the lungs. These ring-looking structures allow the trachea to remain open at all times. The mucus and cilia in the trachea push up foreign bodies and prevent them from entering the lungs. Air finally enters the lungs, which consist of two bronchi, the bronchioles, and the alveoli. The lungs are covered by a membrane called the pleura, which helps the lungs to expand and contract by reducing friction. The two bronchi carry air to the lungs. They're covered with cilia and mucus that carry dust back to the entrance of the respiratory system. The bronchi branch off into bronchioles. These bronchioles carry the air to the alveoli, where the gas exchanges occur. Finally, the alveoli are at the end of the respiratory system. They are grouped in clusters called alveolar sacs. Their shape maximizes the surface area in contact with the air and optimizes gas exchanges with the bloodstream. Each alveolar sac is surrounded by tiny blood vessels called capillaries. Gas exchanges occur through these capillaries and the thin, moist walls of the alveoli. After the gas exchanges, the air exits the body along the reverse path. The air passes through the bronchioles, the bronchi, the trachea, the larynx, the pharynx, and finally the nasal cavity.